There's been a shortage of nurses since 2012, and now the shortage seems to be worse than ever before. DCH is receiving funding from Governor Ivey to help resolve this issue. WVUA 23's Karis Harmon explains.
Tamika, there is still a severe nurse shortage, but because of new funding, travel nurses could help alleviate the situation. Governor Ivey announced she has access to about $12 million in funding that can be used toward getting more travel nurses in Alabama. And DCH is one of the hospitals that has gotten approval for that funding. This approval means that around 20 travel nurses will be temporarily deployed to DCH. DCH has utilized travel nurses throughout the shortage, and while they're thankful for the travel nurses' work and the temporary additions to the staff, Vice President of Marketing and Communications at DCH, Andy North, says one of the reasons that the nurse shortage is so prevalent is actually because the increase in travel nurses.
A big part of the shortage right now is traveling. So there was a lot of federal funding available, and a lot of hospitals started competing, including us, with those travel companies or to get travel nurses. The wages are much higher for a travel nurse, and they're just not sustainable wages for a normal health system. But with a lot of that federal funding, that enabled us to get those emergency staff members in there to help us out, and a lot of people left to try and take advantage of that.
North says they're grateful for the travel nurses, but what they really need is a solid full-time staff. In Tuscaloosa, Karis Harmon, WVUA 23 News.